Hi, this is Ms. Page from the C. Waldo Scott Center Too Good for Drugs program, and today we're going to go over lesson 9, Because I Care, and we're going to get our lesson out of the Too Good for Drugs Teacher's Manual. Now, before we begin, I just want you guys to answer some true or false questions. Number 1, tobacco contains drugs. Do you guys think that is true or is that false? Yes, it is true. Tobacco does contain drugs. Number 2, smoking tobacco products is safe and healthy. Do you believe that is true or do you believe that is false? False. Smoking tobacco products is not safe and it is not healthy for anyone. Number 3, tobacco is in cigarettes. True or false? True. Tobacco is in cigarettes. Number 4, after people smoke for a while, it is hard for them to stop. Do you believe that is true or do you believe that is false? True. That is true. Number 5, people who smoke are bad people. Is that true or is that false? No, that is false. People who smoke are not bad people. That does not make them a bad person because they smoke tobacco. So today we're going to learn secondhand smoke. What do our lungs do for our bodies? Our lungs breathe. Our lungs are breathing in air. So why do you think people are not allowed to smoke in certain places? Because the smoke gets in the air and it can hurt other people's lungs. Secondhand smoke is a mix of the smoke coming from the burning end of the cigarette, the cigar, or the pipe, and the smoke and the smoker breathes out. And it's called mainstream smoke. When non-smokers breathe in secondhand smoke, it can cause serious health problems, and it's very dangerous for smokers as well. When someone smokes, some smoke comes out of the burning end of the cigar or cigarette, and more smoke comes out from the smoker's mouth after he or she has breathed it in, and we call this secondhand smoke. So I just want you guys to look at this picture. On the top row, you see that these are clear pictures of healthy lungs on the top. Now, on the bottom row, these are more of unhealthy lungs, which can cause the emphysema disease with infected lungs. You see how these lungs look and how they're compared to the healthy ones? The bottom row shows smokers' lungs. That's what it looks like. All right, side effects of secondhand smoke. People who breathe a lot of secondhand smoke can have coughs, colds, earaches, or other sickness. If people breathe smoke for a long time, they can also get lung cancer. And let's just say that the secondhand smoke is especially bad for babies, children, and especially people with asthma. Smoke-free lungs stay the cleanest and they last the longest. Remember that. So, because we care about ourselves and our body, we do not want to breathe smoke from other people's cigarettes, cigars, or pipes. Because we care about our friends and our families, we don't always want to tell them to not, smoke around us. But here are some ways to avoid secondhand smoke. You can go to another room. Or if you're in a restaurant, you can ask to sit somewhere else. Some restaurants do have a smoking section, but most these days, they really don't. The third one, you can go outside or you can open up a window. Okay, so just because it's your friends or your family who is smoky, that does not mean that you do not want to be afraid to tell them not to smoke around you. You can politely ask them not to smoke. Just remember that the drug inside of the cigarettes, cigars, and pipes is tobacco, and it makes it hard for the smoker to quit smoking. But if the smoker is a friend or family, that you care about, it's okay to let them know, and they can also be considerate of your feelings and agree with you not to smoke around you. Alright, so that's all I have for you guys today. What I would like you guys to do is to comment your first name under the video and comment something that you learned about the PowerPoint today on secondhand smoke. Thank you.